Day. Week in, week out, we bring you Black health professionals from all over to educate our people, to empower our people, and to discuss relevant topics that would improve our health and well-being. And we're in the month of August already, believe it or not, it's the 6th of August. And we really appreciate your time joining us for these health hour sessions every Saturday. We know that people have very important things to do, but you do make the time to join in. So welcome to our audience joining us on Zoom, on Facebook, on YouTube, wherever you are joining us from. I'll be your host for today. My name is Dr. Diana Asante, a GP, and we have a very important personality today who is a consultant in emergency medicine. He's a friend of the CATHIP Health Hour session. He's been on this program so many times and discussed so many relevant topics with us. As usual, we will have the initial bit of the program where he takes us through the slides and the presentation. And then after that, we have an engaging session of questions and answers. So as we go along, please do feel free to post your questions in the chat box or send messages across, and these will be addressed when we get to the Q&A session. And if the time permits as well, we will allow people to unmute themselves to ask questions to make this a very interactive session. So as I said, we really value your time and we hope that you really enjoy today's session. Now we have a presentation on sepsis today. And I'm sure most of us might have heard about sepsis, or maybe some of us haven't heard about sepsis before. It's a very important topic, it's relevant, and it's a very huge killer. It's an emergency situation as well. So we talk about all these medical conditions, but sepsis is a very important condition that we need to know about. And so we've got an experienced consultant in emergency medicine, and his name is Dr. Mohamed Kamara, or rightly so, Mr. Mohamed Kamara, and he will be taking us through today's session. Welcome once again to the CATHIP Health Hour. Over to you, Dr. Kamara, and thank you so much for honoring our invitation once again.
Thank you so much for having me. Morning, everybody. Let's see.
Good morning.
Can you see it?
Yes, we can see it perfectly.
All right, let me put it in the mode that I want to.
Remember, the chat box is monitored throughout these sessions, so you can post your comments, your contributions, and your questions in there, and these will be attended to. The digital assistants also offer continuous engagement throughout the program. Thank you.
So, the situation is such that I don't know if I can do justice to this subject. It's such a big topic, like my colleague said, that, you know, going through it in what, 45 minutes, 30 minutes, you probably would not be doing it any justice, but I do what I can to cram as best I can into this. So, I don't know if you all are aware, this topic is so important that the World Health Organization declared the 13th of September a World Sepsis Day. You know, despite it being a medical emergency, you know, and it's attached to all the other health days, sepsis as a topic or as a phenomenon does not get the attention it deserves. And therefore, it is important that we heighten the awareness with the view to saving lives, because sepsis is a big killer. I can tell you that. So, if you look at the logo, it says prevent it. That's one way of stopping it. Yeah. And if you can't prevent it, and unfortunately you then fall foul of it, of sepsis, then it's important to spot it. And if you spot it, probably you're better off spotting it at the very early onset, because that is when you would actually be able to make some inroads in terms of treatment and things like that. Because other than that, it goes out of control and then it becomes a problem. It then becomes a touch and go thing. And of course, if you treat it in time, there is a high likelihood that you can beat it. So that's what that is. Prevent it, spot it, treat it, and of course, you're likely to beat it. So, I mean, if you look at this on the left, you would see I've just put facts and stats about sepsis. You have to understand the significance of sepsis. Look at that, 47, almost 50 million cases a year. So it just tells you how this is. And of those 50 million, 11 million are likely to die. There may be more, maybe underreported in our countries, in our, back home and all that. If we don't get the statistics and all that, but at least you have 11 million and maybe a lot more than that. 1 in 5 deaths in the universe as we are is definitely associated with sepsis. In hospitals where we all rush to, the #1 cause of death is definitely sepsis, and it obviously causes readmissions as well, and it costs a lot. It costs a bomb to the healthcare in any country. Now, when you survive sepsis, that is not the be-all and end-all, because up to 50% of people who survive sepsis do have a battle on their hands because they have long-term physical and psychological effects. We'll find out how that is. And of course, this is unsurprising. 40% of the cases are definitely the children, and in particular, the ones under 5. But one thing you must remember is that, as my colleague alluded to it, it's an emergency. And if you know someone who's got the signs and symptoms of sepsis, please, 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 and pretty please, seek medical care immediately, because every hour counts. Okay, so 80% of these cases can and do occur outside of a hospital. Now, obviously, we know the causes, but not all of them. We know that definitely it becomes associated with infections, the likes of pneumonia, the likes of the gastrointestinal tract, the bowels, the skin. Any part of the body can actually succumb to sepsis, as it were. And of course, the recent pandemic is not exempt from this. So it is not only a viral infection, it is also possible bacterial and possible fungal, and of course it could be a combination of all of that. On the right here, you have, the sources of infection. As you can see, we talked about that already, pneumonia. Empyema is where you have pus collecting in like the bowel or in the lung. Urinary tract infection, which we know. Now, the pneumonia and the UTI are very, very common in the elderly, and most of the time, if the elderly deteriorate very, very suddenly, these are the 2 main ones that would actually cause that. Acute abdomen, where you have belly ache, you don't know what's happening, whether it's the gallbladder, the appendix, the bowel, the pancreas, the kidneys, all of that can cause, sepsis. Meningitis, of course, we know that because we've been hearing about that. The drive is there for us to be alert to this. Infection of the heart, and a lot more. Then you have the signs and symptoms. Now, they're there, but I think we'll have to talk about that later on. You would see exactly what I'm talking about. Now, if you get a temperature of above 38 and your heart steps up, it just kicks off, because every time you have a temperature increase by 1 degree, everybody says 37. If it goes up to 38, you expect the heart rate to go up by 15. So if you expect it to have 60 to 100, which is normal, you probably would expect above 100. So if you get that, and then when they look at the blood test, they find out that your white cells, i.e. the army, the defense of the body is low, it should be between 4 and 11. And if yours is less than 4, sometimes people with cancer, sometimes people with chronic illnesses will get that kind of thing. But I think we'll go through them and you'd see exactly what I'm talking about. So that said, what is sepsis? a lot of times, people confuse septicemia with sepsis. Now, I want that to be clear from the onset. Sepsis is, I don't know, of course, people use this expression, drama queen. Well, if you liken that to what is happening here, we face infections every day. The bugs come and we live with them. They're on the skin because the skin is waterproof. You don't get to know anything. It's grappling with that. They're friends of ours and we live and benefit from them and they benefit from us. There are times when that skin is breached, the waterproof business of the skin is probably tampered with or maybe breached, and then things begin to happen. So the body then responds in a way. Normally, it's, what's the word for it? Commensurate with what is bombarded with the body, if you like. It's more like proportionate. That's it. That's the word I'm looking for. So proportionate. So when he bombards you with a certain amount and you respond, the body responds. When the body responds abnormally or disproportionately, that is when you expect sepsis to take place. And as it is, you may well have life-threatening illnesses, but when the body responds in that abnormal way, overzealous way, then it begins to turn on itself and it begins to injure the body organs. And that is what sepsis is. So I need you to understand the difference between sepsis and septicemia. Septicemia is the semia, CAEMIA, that you can see is actually blood. So AEMIA, it's actually blood. Now sepsis added to blood is what is called septicemia. So it's a bacterial infection in the blood. That's what septicemia is. Whereas sepsis is an extreme, abnormal, overzealous response of the body to an infection, which then turns on itself and starts destroying the organs of the body that it's affected. In that way, it becomes a problem like with the heart, with the kidney, with the brain, and all of those, with the liver. So sepsis has got stages. You might not know this. The medics would know this. There's 4 stages, as it were. So the first stage is SIRS, which is like a systemic inflammatory response, to the infection. So when the bugs bombard you, you get a temperature that rises, which tells you there's something that's coming to the body. And then, of course, with that, you got the heart rate increasing because, as I said, for every 1 degree, you get 15 beats added. And then, of course, the number of times you breathe in gets higher. So you're expected to breathe 20 times a minute. But of course, because you have to compensate for that, you then go a bit higher. And when they look at the blood results, when they look at your blood results, they would see that the white cells, as I said, the defense of the body goes above 11. So anything above 12, and as we said earlier, less than 4 in cases like immune compromise, in cases like cancer, TB, chemotherapy, and all of that, definitely you'd expect to have this SIRS, as we call it. And then if that is not stopped, it then moves on or maybe, worsens to sepsis. And sepsis, there's 3 stages in sepsis. So sepsis on its own, and when it worsens, it becomes severe sepsis. And then, of course, when it gets to the end stage, you then develop what they call septic shock, by which time it's very difficult to say that person would actually recover fully or come back from it. So you need to see that. So if you have 2 of those of the SIRS on the left that I pointed out, plus a confirmed or suspected infection, then you definitely would be deemed to have sepsis. And of course, all the symptoms of sepsis, plus signs of end organ damage. Now, for example, the person is not producing enough urine or is not urinating as much. And if you ask the mothers, they'll tell you, oh, my child is not drinking much and possibly is not wetting the nappies as they should. That is a sign as well. So it tells you the kidneys are not functioning. And of course, if added to that, when they do measure the blood pressure, it's less than 90. That top figure, which should be 120, is less than 90. And the bottom one, which should be 80, is less than 60. Then clearly, there's something serious going on. And of course, again, from the blood test, that lactate is one that indicates how the body is functioning, whether with oxygen or without oxygen. And of course, the septic shock, which is the end stage, clearly, that is where things become really, really difficult. And that could ultimately, if not halted, could lead to death. So it's important for us to talk about the symptoms. Now, anyone with an infection who develops the symptoms, the following, i.e., we talked about the pulse already, because it goes higher because it has to accommodate for the body to function properly. The heart will beat faster. And of course, if you got a chest infection, or even people with asthma and TB and COPD, you'd see they've got difficulties breathing. The skin becomes sweaty and clammy. That is to do with the blood pressure dropping. That is how the body compensates. So if you have someone with cold sweat, and not feeling well, then think about sepsis, pain in the belly, pain in the limbs, pain, headache, wherever you have pain in the chest as well, definitely you need to think about that. If you have a wound, or, you cut yourself and there's redness, and of course there is swelling around the wound, and you're becoming a bit unwell, then you need to remember that there is possibility of sepsis. Then, of course, you have the blood pressure, as we talked already. We said that the blood pressure will drop because that's what happens. That is what we look at when we're in the emergency department. If someone comes to us and they're septic, if the blood pressure is on the low side, we know then that we're looking at, a bigger problem, a very serious problem, because with the pressure being low, the kidneys don't get to do their job. And so therefore the urine is less. And if it gets less, then there's a likelihood for the kidney to get damaged. And that in itself poses a lot of problems. Dizziness, feeling faint, we talked about the urine output as well. I've just talked about it. If you see someone, in the darker skin, obviously it's very difficult to appreciate, but pallor, being discolored, like a yellow tinge or a, darker mottling of the skin, you would definitely notice that. And of course, if there's fever and chills and the person is shivering, check to see whether there's a chest infection or there's a water infection. Again, the symptoms are continuing, and they're not by any means exhaustive. There's a lot. There's not one symptom that will tell you about sepsis. It's a combination of all of those, not necessarily in that same order, but definitely. Someone can have slurred speech, and of course, diarrhea and vomiting is it's a big thing, because with diarrhea and vomiting, you lose the blood pressure, and of course, the kidneys then become suspect. Pain we talked about, shortness of breath we talked about. Confusion, that's it. In the elderly, confusion, acute confusion, that's one thing you need to screen for sepsis. Reduced alertness and changes to the person's mental status. I've seen somebody who is as nice as a pie. They got a water infection, an 85-year-old man. He was absolutely vitriolic. 2 days later, after we started giving him antibiotics, he was the nicest man you can come. He came and apologized to us. But he was absolutely violent. That's what happens in sepsis as well. And then of course there's the issue of that pending doom, that that feeling of doom, like you're going to die, that is all part of sepsis really. And if they faint, then obviously then that you're looking at a bigger problem. So I thought I could actually compare the symptoms in children to the ones in adults, and you can see for yourself that those who are mothers and fathers will know this. If you've got a child, you've got a baby who's breathing very fast, which is not normally the case, then obviously think about it. If you have that in combination with a convulsion or a fit, like febrile convulsion, they've got a temperature, they're breathing fast, and now they're going into a fit. And maybe they look mottled or they look pale, then obviously. And of course, if you have a rash that when you press the glass on it doesn't disappear, be very concerned, and you need to be heading to the hospital as soon as possible via ambulance. If they're lethargic and they're difficult to rouse, they might be sleepy, maybe it's past their bedtime, but if it's difficult to rouse them and they feel abnormally cold to your touch, then definitely you need to be concerned and be bringing them to hospital as soon as possible. In the adults, as you can see, it's a nice mnemonic that I have there, which says, slurred speech or confusion, that's the S for the sepsis, extreme shivering, and of course, not passing as much urine as you expect during the day. If you've been going on, maybe 4 times, 5 times, and now in 12 hours you haven't passed urine and you're not feeling well, then be mindful that this is heading towards sepsis really. If you're short of breath severely, i.e. more than 20, if it feels like you're going to faint or die, and of course if the skin is mottled and discolored, then yeah, these are all things to look out for. So there are risk factors, and as I say, it's always important to remember the genetics are, are a risk factor. That's something you can't do much about because, we inherit the genes from our parents. But obviously, there are things we can do much about. Now, sadly, age isn't one of them. So increased age or early onset, like the very young and the very old, they're very susceptible. And of course, someone who is fallen foul of cancer, some medication do obviously reduce the immunity and the defense of the body. Diabetes, we know, can cause that. And of course, alcohol abuse can cause immune suppression. And of course, if you're immune suppressed, that means you are exposed to possibility of superimposed, that's what we call them, superimposed infection. Because the body would normally fight, but then if it can't fight because of the fact that it can't mount a defense, then that's what happens. And that's what we call immunosuppression. So the young, the less than 1 or under 1, and the over 75 are very much at risk, and the risk factors, as we see, people with learning disabilities, they're at risk. Someone with poor mobility, someone with poor communication, of course, hearing as well. And of course, the dementia, as we know, as we get older, we get more vulnerable, right? And the male, sadly, we're more at risk, of issues like anastomotic leak. So if you had an operation where they join the bowel side to side or one to the other next to each other, then sometimes the male are more prone to having infection from that because the age. Another thing is smoking, and of course you lose blood and you lose fluids during the operation. That can actually reduce the blood pressure, and that can actually make you prone. So people who are like asthmatics, people with giant cell arteritis, like this tender scalp, people with polymyositis, people with these other illnesses that are that actually demand or require corticosteroids, like the steroid tablets, are sometimes very prone to infection. And of course, the healing is worse, and so therefore they're prone to infection. Again, diabetes as well. The feet, the urinary tract, i.e. the elderly people who have got the indwelling catheter because maybe the prostate is big, or maybe cancer, or maybe just unwell, they can't move, so they put a catheter in. Definitely, they're also prone because this is a foreign body that goes into the body. And if you sort of try and tamper or interfere with nature, nature has a way of fighting back, and that's the kind of thing. So you can see that the stomach, the chest, the kidney, and of course the brain, all of those are susceptible organs and systems in the body. So again, we just talked about it. This is just a representation of that, really. The older than 75 and the ones under 1, and the ones with immune systems that are, weak, definitely, like HIV, the ones who've had cancer, as we said, the ones who've had recent surgery, the ones who've had babies recently, they've just delivered, or they've had a miscarriage, the ones who've had organ transplants, the kidney, the heart, or the lung, or the liver. All of those are very, very prone because they have to take tablets that knock the immune system so that it doesn't reject the transplanted organ. And so therefore, it makes them prone to infections, if you like, So you need to understand that time is of the essence, There's no questions about that. Every minute in dealing with these people counts. And the sooner you start the treatment or the assessment, the better it is for the outlook. So, as it were, this is just again graphic, representation of the ones who are at risk. Pregnant women, or the ones who've just delivered. The little ones who've just been delivered up to 90 days, they're known as neonates. They are also very prone. The elderly, of course, that's the other end of the spectrum, if you like, or the spectrum. Yeah. So very early, very young ones, and the very elderly ones, obviously. The immunosuppressed we talked about, the ones with chronic illnesses, and the ones who are hospitalized. Remember, I, in particular, am one of those that doesn't like bringing patients to hospital because of the fact that I can only bring them if I know that the illness is not something we can treat or treatable at home. They would need in-hospital or inpatient assessment and management. Other than that, I send them home because of the fact that people do not realize that a lot of the sepsis we're talking about, a lot of the infections we catch in the hospital. Yeah, we go there for treatment, but I guarantee you get a lot more that you pick up from there, believe it or not. You know, we talk about plane crashes and number of people dying. Nobody knows what is underneath that. I can tell you that if you compare the plane crash, which kills 200 people, to what we lose in the hospital, you will not believe it. So just bear that in mind. When people come and say they want to be admitted and this and that, just bear in mind that you might just be mindful of what you wish for. Yeah, so the causes of sepsis, as we said already, it could be bacterial, it could be fungal, and of course it could be viral. And of course, we're not forgetting this friend of ours, if that's what we call him. I would say 4 of ours, COVID-19, it's not exempt from that category at all. It could enter as a pathogen or as a bug, could enter the body through a wound. Now, it's either during surgery, and sometimes you might not even know you've got it. So it can enter in any way, and then of course starts affecting you. So just be mindful of that. So when you come to the hospital, like you come to me, there's one thing I always need to do. I need to get a very good medical history. You know, so I need to ask you questions, and you need to tell me what's wrong with you, and then including the details of infections you may have had, whether you've been abroad recently, whether in the family there's anything that has gone on, and what you had in the past. You know, and then of course I can then examine you, and based on the assessment and based on what I find from the medical history, the past medical history, surgical history, your medicines you take, your allergies, who you live with and how you live and where you live and how you mobilize, and of course the physical examination results, I will then format a working diagnosis. That's what we call it. It's not definitive, but it's a working diagnosis. And sepsis, as you know, because it hasn't got anything definitive, but there are certain things you look out for, which will definitely tell you that this is what it is. And so obviously you start treating them. So you do the vitals, which is important, because if the blood pressure is low and the person has got a temperature and is breathing fast, then you know you're dealing with sepsis. So you then do the necessary blood tests, including blood cultures, get the urine, give them the fluids, and then give them the necessary antibiotics, broad spectrum antibiotics. You might need to do chest X-ray. You might need to do an ECG to see how the heart's moving. And of course, the urine would give you an idea whether this is urinary tract or not, or maybe a concomitant, i.e. they're going together with the other organs, you see. Now, there's a pitfall in doing this, you know. Whilst it's essential and absolutely vital for you to start treating as soon as possible, preferably within the first hour. That's when you expect to get maximum, if you like, effect. But sometimes the symptoms such as a high temperature and all that, they can occur in other conditions. An example is someone who overdoses on illicit drugs. They can actually make you get a temperature. And if you're treating that temperature as if you're treating someone with sepsis, you'll be going down the wrong way. Definitely, that person will deteriorate and they will die because that's not what caused it. So we as doctors have to, you know, think on our feet, especially the likes of us who are in the emergency department. People come with all sorts of things from top to toe, male, female, young and elderly, even the ones in mummies and bellies. We have to deal with them, and that means we have to be thinking, and we have to get it right at the first attempt. So, GERF, definitely we have to do that, because otherwise there'll be problems and there'll be difficulties, and then we end up with red faces and sometimes in the bad books. So, as I say, you commence rapid treatment for sepsis, including treating the cause of the infection, administering the antibiotics we've said already. If it is a bacterial one, then obviously antibiotics are the best. If it's viral, obviously antiviral, you know, but sometimes the viruses can knock the immune system, and sometimes you have superimposed infections, like in HIV, you have fungal infections, you have AIDS in particular. You have fungal infections, you have viral infections superimposed, and so it becomes a bit difficult to treat. So just giving antibiotics might not be the answer. It might be a combination. Like, for example, meningitis. There is viral meningitis. There is bacterial meningitis. So because you're not quite sure and there's nothing to tell you at the very beginning, you're always allowed to cover for the virus rather than just go for the bacterium when it could be just a viral one. So it's important to remember that. Obviously, oxygen is absolutely vital, especially the likes of us who are colored. We need the oxygen. Intravenous fluids we talked about already. to ensure that the blood flows to the organs. We have to provide an assisted means of breathing, if appropriate. Sometimes we have to, take them straight to theater. If at all we find that the culprit is in the bowels and the bowels are dying and they're causing the poison to go into the blood, and so therefore you have to remove that damaged tissue, And sometimes when they would have had that, or they are so unwell, they have to be in an intensive care unit. And sometimes you will need to intubate them and, put them on the ventilator for them, to get better before you can extubate and take the breathing out, apparatus out. Remember that because they are, unwell and they're lying on their backs, then definitely they are prone to pressure sores, ulcers. And that's important to remember, that need to be turned frequently. And, of course, because they're not moving, the blood congeals in the lower limbs and they're prone to clots in the lower limbs. So therefore, they need to be treated against that prophylaxis by thinning the blood. And of course, because of the severe sepsis, the control of the blood sugar can go really haywire. And as a result of that, we need to look at controlling the sugar. But of course, we do maximum best, we maximize the efforts and all that. But there are times when we come to the point where we know that the disease-directed therapy is not effective. And in that case, we probably need to sadly consider end-of-life care, which, as I say, is humane in certain circumstances, and of course is the right thing to do, rather than prolong the suffering and being obviously subjected to unnecessary suffering, really. So, as we said already, time is muscle, time is money, and time is definitely what would save a life. So that's what this is about, time, watch for it, temperature, infection, mental decline, and of course, if you have anything extreme there, definitely think about that. It's absolutely vital. Shortness of breath, severe discomfort, and all that. All of these are pointing to one thing, that you need to seek help urgently, immediately. Call 911 and maybe take the patient, be it an elderly or a child or a baby, to hospital. I cannot stress this enough. So this is just a graphic demonstration or representation of what we do. When you can see that this is an ITU setting where you can see the antibiotics going very early, preferably within the first hour. But as you can see, the demands for beds is like up to 12, sometimes 24 hours, as you can see. It becomes extremely difficult. We've lost patients because of the fact that we couldn't get them into the appropriate setting for us to administer the antibiotics in time. So it's an ongoing struggle. It's a big, big issue for us. The exit block is a problem. Fluids, that, and preferably the ones that are befitting the body, not the ones that have starch or have high chloride. The ones you give are the colloids, which are like the fluid we have in our body. And then, of course, if the blood pressure dips and you're giving the fluids, i.e. you're giving up to 2 liters, 3 liters, and this patient is still not responding, the blood pressure is not up, then you need to then consider giving other substances, what we call the vasopressors, And of course, because they're not eating, you have to have a way of actually getting them to feed. That's when we go through the gullet, the food pipe, and do it either through the vein or through the mouth, but through the tube. And of course, like I said already, the blood sugar control gets completely disrupted, and so therefore that needs to be looked into. The lungs we need to protect. That's why we're putting them to sleep and put them on the ventilator until they get better. The urine output is absolutely vital, because that will tell you how this person's body is working. If they're not producing urine, then you know full well there's danger there of everything collapsing, everything just going downhill, and that's it. So that's why it's important for the kidney to produce the urine, and that it will tell you that at least they're responding. So if you give the fluids and the urine is not being made, it can either be that they're underfilled, which means they need more, or the kidneys aren't working because of a certain reason. So it's either before the kidneys, in the kidneys, or outside of the kidneys, which would mean maybe there's an obstruction somewhere. So I thought we'd probably just slightly go into this. Now, sepsis in the newborn is absolutely vital. Now, mothers would know this because they're the ones that are alert to this more than us, the dads or the men. sepsis can develop within 24 hours of delivering a baby. It's called neonatal sepsis. And as I say, a neonate, I said that already, that is a baby who is born up to 90 days after delivery. There's a very high risk of neonatal sepsis. Now, sometimes the baby can develop, an infection which is called a streptococcal infection, and especially the group B1. During pregnancy, the mother can have that, and that can then be transferred or transmitted to the baby during delivery. That's a problem, so they will need antibiotics as soon as possible. And sometimes they get kept in hospital for a few days in the intensive care unit, the NICU. If the baby is premature, that's another risk factor, or the waters in mommy broke more than 24 hours, before there's actual delivery. So that's why you find when the waters break, they're actually brought into a safe setting in the hospital. They're kept in the room, and then, of course, they're monitored, they're given the antibiotics, and, of course, the steroids to help with the baby. And obviously, if needs be, they can induce, and if needs be, they can proceed to surgery, like cesarean section, depending on what happens. When the sepsis starts after 24 hours, it's called late onset. And obviously it's after delivery, and it could be a viral, a bacterial, or fungal infection. There's also a very high risk when the baby spends time in the hospital to receive treatment. If we're not careful, sometimes the infection can arise from being in hospital. So this is just something for us to know. Obviously, the symptoms are that there's a change in the body temperature. They feel colder, or they feel extremely hot. They're breathing problems. Definitely diarrhea and vomiting. That's a killer. The belly can be swollen because they're obstructed. The sugar, obviously, because they don't have much control of their sugar, would be down. And so therefore, that's one thing. So if they come in fitting, that's one thing you can always check on. If it's very low, you can definitely improve that by just giving the sugar. And I tell you what, you'd be surprised how they get better. Jaundice, if they become yellow tinged, in the darker complexion, is a bit difficult. But if you pull the lower eyelid and you lift the tongue, or maybe pull the lower lip, you probably can see the yellowish tinge or discoloration, which would help to establish that or appreciate that. The heart rate, in the children, the heart rate is very fast because that's what they need to get themselves going. When the heart rate is exceptionally slow, then obviously there's a problem. And of course, if this baby is not latching onto the breast and they're not feeding as they should, and they have reduced movement, or worse still, they go into seizures, then definitely then there's a problem, and that needs to be dealt with. And most of the time, top of the list is sepsis. So here you go. On the right, you can see the screening that they use in the community nursing. I mean, I don't need to go through all of that, but you have amber, you have red, and the red is what we worry about. But then it's amber that actually leads to red, as you know, green, amber, red. So you have to be really, when it gets red, it's a very difficult situation. It's out of hands already. But if you spot on the left there that the baby or the child has had, a fever in the last 24 hours, and they're definitely cold to touch, and they're breathing very fast, and the skin is pale or mottled, or they have a rash that when you actually press it, it doesn't disappear, or they go into a fit, which we said already, or they're lethargic and they're difficult to rouse or to wake up, then definitely you need to be making steps towards getting this baby or this child to hospital. And this is very important. There is no one sign of sepsis. This is one thing you need to remember. So it doesn't mean you have to have all of them. If that's why we always listen to the parents, especially the moms. If mom comes and tells me, hang on, this is not my child. I know this is a bubbly child, loving child, they always smiles, but it's not being smiling. Even that, or they're crying excessively. I mean, the pediatrician can put me right, that we always pay attention to that. We take that within reason and we act upon that. And most of the times, the moms are right because they know them better. So there's no one sign that you look for to say that's what this is. And then, of course, we swing right to the extreme of the pendulum goes to the extreme there, which is the elderly. We're all going towards that. So they have a high risk because they often have comorbidities, the likes of diabetes, and the immune system obviously is not as robust as it was in the maybe 10, 15 years earlier. And of course, they do have recurrent infection, the frequent that can lead to sepsis. And the trouble with the sepsis is that they don't respond as the younger ones. So therefore, if you're looking for all of those, that's where the pitfalls come in. Most of the times, that's where the medics get into trouble, because of the fact that they look at the figures. They're not treating the patient. The figures might be right, yeah, but the patient is deteriorating in very high. So therefore, you need to focus on your patient. Treat your patient, not the numbers, not the figures. That is absolutely vital. You know, they are malnourished, as it were, and because of that, they're very prone to infections. And the infections don't take the same trend as when you were younger, in your 30s, in your 40s. By the time you get to your 60s, definitely the trend is different, and therefore, elderly medicine is a very important one to look into in terms of sepsis, because most of the time that's when we lose them. You know, it can progress absolutely fulminantly, i.e. rapidly, if you then consider that, well, hang on, this is not the case, the numbers are fine, but then the patient's deteriorating. So treat your patient. Yeah. So they're like 13 times more likely, the elderly, to spend time in hospital with sepsis, you know, than those who are under 65, you know. And when they go into intensive care, they're very likely to sometimes, you know, pick up, you know, bugs that would cause a sepsis. You know, they have, when they recover, they have an increased risk of, if you like, repeat infection. They can end up with post-traumatic stress disorder. They can end up with chronic pain and fatigue. You know, of course, they can end up with organ damage. You know, so it's important, and it's absolutely vital that the patients themselves and their loved ones, their families, recognize the signs and symptoms of sepsis, and prompt treatment is sought in the appropriate places. You know, if you've tried your paracetamol and your ibuprofen, you see that's not working, please, 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 and pretty please, make your way to the ED. You'll be pleased, and you'll be, you know, happy you did that, because you would see the dramatic difference when you get treated. So how do you prevent sepsis? This is absolutely vital. You need to take the steps towards preventing the infection. And of course, if you do get the infection, then you need to receive prompt treatment, that, you know, so that you reduce the possibility of progression to the point where you can't do anything. So vaccines, we know, the flu vaccine, the pneumonia vaccine, you know, meningitis vaccine, and all of that are absolutely vital. You know, if you've got a wound, then make sure it's cleaned, it's kept dry, prevent any superimposed infections, you know. And of course, remember this, wash your hands properly. Now, I don't have to overemphasize it, but I tell you what, there are bugs you can control using your hand sanitizers. But there's one particular bug that you cannot, it doesn't matter what you do, you can't. And that one, you need to definitely wash your hands. And when I mean wash your hands properly, that 20-second thing you're hearing about, it applies to this one. Then you can use your hand sanitizer. The C. diff, this is one, the Clostridium difficile, you definitely have to wash your hands. If not, believe you me, you're putting yourself at risk, and of course the patient you're going to see at risk, because we have it in our body and normally it's fine. But then, as I say, they give antibiotics, and that kills the friends we have, the friendly bacteria. And then of course, the unfriendly ones take over, and as a result, they cause this diarrhea, which it can be really poisonous to the point sometimes they can perforate the bowel and can cause a lot of problems. So when you're going to see these people, you have to sort of, you know, protect yourself and of course the patient. And that's why you have to put your plastic apron, your mask, your gloves, you know, and they minimize the flow of the traffic. But when you come out, or before you come out, you would have taken those off and washed your hands. And that is why it's important, because you can carry that and get infected or get somebody else infected with it. So take immediate action or seek medical attention immediately. You know, remember, COVID is not completely gone. So if you know you are symptomatic, remember to be wearing your masks when you need to wear them. So this is for us, the healthcare providers. You know, we need to educate our patients. We need to remind our patients that taking care of the chronic illnesses helps to prevent the infections. And we need to encourage, you know, infection prevention measures as we're doing now. Hand hygiene, as I say, and the vaccines, we definitely need that. If you look on the left, you see that the adults are prone to 35% lung infection. So when you talk about sepsis, sepsis mainly can be caused by the lung infection, because that's the only organ that communicates with the outside world 20 times a minute. So therefore, it's very prone. And second to it is obviously the urinary tract system. You know, sometimes you get kidney infection, so that's down to 25%. And of course, following that is infections in the bowels. And of course, last but by no means least, you have the skin infection. So these are the signs we talked about already. They're there and you know what they are already. Recovery. I just touched slightly on that because I'm conscious of the time. Most people make a full recovery from sepsis, but it can take time. So therefore, family support is absolutely vital. You might continue to have physical and emotional symptoms. PTSD is one of those. Depression is another one. Anxiety, change of mood and all that. If it affects the brain, then definitely, just be mindful that these people can sink into depression. And so therefore, they need the support, they need the understanding, they need that close-knit family, that cohesion, that dynamism for them to pull through. It's called the post-sepsis syndrome after you recover. And as I said, feeling tired, weak, sometimes you just have difficulty sleeping. And of course, the appetite is not what it used to be. And of course, you are prone to reinfections. And sometimes you get flashbacks, and that can cause you problems. So what do? Well, if you are someone who's in employment, then maybe ask for some changes in your work schedule or your duties and things like that whilst you're recovering. Don't rush yourself, please, into going back to work. I know we all need the money because of the economic hard times and all that, but you're better off being well, taking a lot longer to go in and continue working without any interruptions than when you go in, and then you end up actually taking more time up. And of course, you trigger that rule or that particular issue whereby nowadays people are disciplined because of the fact that they take too much time off work. So it's important that exercises, calibrate them, build your strength gradually, take some tips or try some to help you sleep better. As I said, we talked about the personal hygiene, the vaccines, the lifestyle changes, the smoking, the alcohol. There's help, tremendous help there to help battle these demons. And of course, the timely assessments are absolutely vital, whether 6 monthly, whether annually, or any of the follow-up appointments that you're given, you need to do justice to them by attending. You never know what you can get from that. Remember, there are support groups, and Sepsis Trust offers that for survivors of sepsis. And of course, your best friends there, the GPs, will help. Try to eat, as best you can, even if it's little, but do that, and as I said, don't rush your recovery. So the points you need to take home are that do not ignore the early signs and symptoms of sepsis. That's one. 999 or 911 is there for you. It's your friend. Take them to the A&E. Nobody will frown at you. In fact, they will thank you for doing that. Early treatment is absolutely vital. Most people recover from sepsis, but sometimes it could take a lot longer, to recover. So therefore, there's the need for that. Treat any infection right away. That's for us. Comply with the national and regional care bundles, based on the evidence-based medicine, and of course, in the appropriate setting. But remember, it could be long, and learn to spot these signs and symptoms of sepsis so that you can act upon them as soon as you can. Thank you so much. These are my references. And as I said, I whizzed through that because sepsis is a big topic. But I hope I would have done justice to that. And I'm happy to field some questions and respond as best I can.
Thank you. Thank you so much. And indeed, you have done justice to that. And in the last 45 minutes, it's absolutely a massive topic. And you've given us a lot of insight within these last few minutes. Thank you so much, Dr. Kamara. So for those of us who joined along, after the program started or in the middle or along the line, Dr. Kamara has been talking about sepsis, and he's told us that sepsis is a big killer. It's an emergency. And the most important thing is to try and prevent it and spot it early. So if you can prevent it, that's the best thing. If you can't, then try and spot it early. And he's given us through all the signs that we need to know. And if unfortunately we catch or we become septic, then we need to get early treatment. It's not the sort of thing that we will be sitting and umming and ahhing about. We need to get to hospital ASAP. Time is of the essence because it kills millions. And Dr. Kamara, thanks for going into the details about the neonates and the elderly and adults and all of that, because it is important for us to know how to spot the various different presentations. Now, just for the benefit of our viewers as well, our Health Hour, which we're hosting now, is the CATHIP Health Hour. Now, CATHIP is the Caribbean and African Targeted Health Improvement Program, and is delivered by a partnership of CAHN and Black Health Initiative, Croydon BME Forum, Enfield Caribbean Association, Rafa International Development Agency, and the Royal Redeemed Christian Church of God in Sheffield. You're all welcome once again. So we're going to zoom into our question session. I also just want to remind viewers that at some point feedback forms will be sent out. So please do send us your feedback, complete those for us kindly so that we know how to improve these programs for our benefits, all of our benefits. I also want to mention that we have the Healthy Heart sessions on a Tuesday, where we talk about diet and lifestyle. And Dr. Kamara did say that immune system is important. So anything we can do to boost our immune system to make ourselves healthier is important. Right, so we zoom into our questions. Now, Dr. Kamara, when you were speaking, we had some very important questions coming through. Angela was asking whether someone is more likely to become septic following surgery, whether that is a likelihood, whether that's a possibility, please. Thank you.
Yeah, it's a risk factor. Definitely a risk factor. As I said, I think I alluded to that, and there's a picture that depicts that. On the left there, you saw the diagram and the picture of the belly. Obviously, as I said, when you open the bowel or you open the belly, which they call laparotomy, obviously the skin, we can try and disinfect it as best we can. And of course, we have friendly flora, if you like. We have the bacteria that live in our guts, and we live with them and they live with us. You know, it's like a mutually beneficial relationship. When you interrupt that, because sometimes you have to give antibiotics, and the antibiotics has no way of acting apart from, you know, robbing Peter to pay Paul, if you like. Is that the expression? So it's like killing the ones that are good for us, and then if in the ratio, the ones that are not good for us over sort of populate the guts, then of course you have immune suppression. There's no questions about that. And of course, after surgery, you won't be eating, you won't be feeding, you won't be getting the same kind of nutrients that you need. And so therefore you are, you know, a bit under the weather. You are under par, if that's the expression. So clearly you won't be firing on all cylinders. And as a result, that's a risk factor, especially in the elderly. It's absolutely vital because the immune system is not as robust as it is. And so therefore you're very prone to that. And that's where you see the anastomotic leaks, they call them, where the connection of the bowel, you know, one to the other becomes a bit suspect. And so that in itself poses infections. And of course, if you can't fight the infections and the antibiotics you give in are now posing another question, then obviously you are like hiding to nothing. So that's the kind of thing. So surgery in itself is a risk factor. There's no questions about that.
Yeah. Thank you for that. Okay. And Angela, I hope that answers the question for you. Dr. Ambrose, who's on holiday at the moment, he says, good for you, Dr. Ambrose. So he's asking about delirium and how that is related to sepsis. So we hear the term delirium, we hear the term sepsis. Dr. Ambrose is obviously a mental health specialist, a consultant. So from that point of view, or for the benefit of all of us here, the audience here, what is the link, and if is there any at all, between delirium and sepsis, and how may that present in, you know, mental health patients or even any patient in general?
Well, you know, the delirium is a broad term, like everything else. You've got to actually narrow it down. If you're looking at delirium tremens, for example, you're looking at somebody whose mental status is not as alert, you know, acute confusion, you can class that as that. The reduced GCS score is classed as that. So it depends on what you're actually thinking about. But if, say, for example, someone who is abusing alcohol, for example, or maybe misusing alcohol, and I tell you what, alcohol can actually impact the immune system negatively. So that person comes in and maybe they're withdrawing, and you are lured into that false sense of insecurity, should I call it, where you say this person is drunk, they're just withdrawing, when in actual fact, because the immune system being in its boots is now brewing an infection, and they're not actually manifesting as they would had the immune system being at its stage where, you know, it's very robust, then you have a problem. And these are the pitfalls that always, you know, we as clinicians face. We have to be thinking on our feet to say, hang on, This guy, yeah, okay, he drinks and all that, and the rest of it. He uses, all these illicit drugs and all that. But hang on, the baseline is not that. Okay, so I need to look at, hang on, is this because of what is happening to him, or is there something else underlying that is actually doing that? So I'm not taking it just on face value. I need to ensure that I'm looking at it holistically. Yeah, the whole of it. I need to be thinking outside of the box, not just what the numbers say, because the pitfalls are dangerous, and that is when we get caught out. So it's important to take that within that context. To say delirium on its own is not specific of mental health on its own, but it could be something else underlying, and that's why you take it. So you dig deeper. You're not just saying, hang on, this guy is drunk. Something else might be there, and that is your responsibility to weed or tease it out in order to treat it, concomitantly. It's as simple as that.
Yeah, thank you for that. That's really important, and you keep hammering as well that we should treat the patient, not the numbers.
Absolutely.
And I think it's important for all of us, whether we're clinicians or not, that we know the people we know how our children are, we know how our mothers, our fathers, our relatives, our patients, and if someone is different from their usual baseline, that is telling us that something isn't right. And we also need to, as clinicians, listen to our patients as well. We need to listen to our patients. So thanks for that. And thanks, Dr. Ambrose, for your question as well. And another question is, how can sepsis be managed in the community? Is it commoner amongst the Black population? So I think it's important you clarify for us. Is this something we should be managing in the community in the first place if we're at the septic stage? And if so, then how can it be managed in the community? And then the follow-on question, is it commoner in the Black population? Thank you, Dr. Kamara.
Well, I mean, again, it's one of those things that doesn't have any right or wrong answer. The fact remains simple. I know myself, for example, if I have my child who is normally full of bins up and down, or I have my dad or my mom who I know is sprightly, and all of a sudden I see them, day one, they're getting exhausted, easily and all that. I notice some change. That's the important thing, then definitely, if they tell me I've got a headache, I might say, well, let's try a paracetamol or something, Of course, if I'm going to be giving something like ibuprofen, I'm going to be mindful of the fact that maybe they might be on blood thinners or something or whatever, So all of that comes into play. But if I've done that, and I've noticed that in that period that I've done that, within 6 hours or maybe 12 hours or maybe 24 hours, I see that there's a drastic deterioration, there's no point in me delaying. I need to go to the right place, because I know now, based on this talk today, that if I know that what I'm doing is not being effective, it's not gaining me any mileage, then I need to go to the professionals that actually can do it for me. So the sooner you go, the better. Don't wait until things become really way beyond reproach, if you like, or maybe you can get that going, then obviously you then might be a bit too late, because once the end organ damage is inflicted, it becomes a bit difficult to determine how it pans out, maybe by some miracle, by the man above and all of that comes in. But the fact remains simple, you need to monitor whatever you do. I mean, when we go for courses, they always tell us, whatever you do in terms of treatment, or maybe something you do to sort of address a particular situation. For example, somebody is struggling to breathe and you put a mask on them, what do you do to determine whether the mask is working or not? You then check to see whether the mask is steaming, You have to check whether this person is actually not breathing as fast or not using as much muscle. So you always need to reassess. That's the only way you can keep up on top of things. So the one that you've seen already, and the action you've taken, make sure it's working. If it's not working, then I wouldn't say out of depth, you will then go to where you can be helped. It's as simple as that. In terms of the fact that in the community it is there, and that's why the slide I showed you, the nurses are there, the doctors are there, but you yourselves know yourselves better than we do, and that's why we need to listen to you. So if you say this person is not well, maybe you might say, oh, you're crying wolf, but we know for sure if someone came to my hospital, I need to make sure I'm not missing anything. It's as simple as that. For example, I give you an example of a man that I saw yesterday. When I looked at his leg, he told me he'd fallen down a truck, a forklift, and his leg went, underneath him. So what my colleague did was to examine and said, I tell you what, this looks like a fracture. Well, then what? we did an X-ray, and the X-ray did not show any fracture. But think about this. What happened to this man was the leg was so swollen that you think this is a fracture, but it isn't. And then what did we do? I asked this man some questions. Are you taking any medication? And he said, yes, I'm on warfarin. I said, oh, you know what I mean? Yeah. So now he's bleeding into the tissues, which you wouldn't see on the X-ray. And so what I'm concerned about now is this man has got a bigger problem than even a fracture, because he may well have what we call compartment syndrome, which would mean I have possibly to rip this man's muscles so that the muscles don't die. So you can see what I'm trying to say. So it's important to remember that when you do something, assess what you've done. How effective is that? If you're not getting anywhere, I mean, A&E is there for you, and it's actually free of charge. Access it at any part, any point in the country, you will get that. Of course, in terms of the people of color like ourselves, well, there's certain characteristics that we're not responsible for. We can't actually determine because of the fact that, you know, we don't choose where we're born, we don't choose our parents and all that. But yeah, we are more prone to that because of the fact that we're more susceptible. As simple as that. We have the underlying illnesses which we don't know about. You know, diabetes is a killer, you know, and it actually impacts on that. You know, we're the ones who have the living conditions not up to scratch. We're the ones who are living, you know, in crammed houses. You know, the conditions there are not up to, you know, expectation. We're the ones mostly living under the poverty line. We're the ones that carry 3-4, you know, jobs, you know, exhaustion, lack of sleep, you name it. All of that impacts the immune system, impacts the response to infection. And so therefore we're more prone. And of course, there's this big issue of vitamin D, you know, deficiency as well. So there is this drive. So all in all, we're more prone, and that's why we need to look after ourselves. We need to, you know, stand at the head of the queue to get ourselves better and access this to the point where we know equality and equity of the healthcare is the same for us of color and of their counterpart, the Caucasian.
Very true. We need to make sure that we get the information and we use the information to our benefit. Yeah, so as he said, if you spot the signs, seek the help, reevaluate, and if we need to move on to the next step, let's do that. Sepsis is an emergency, it kills, so we need to get help as soon as possible. And Dr. Kamara, there are lots of comments in there about how helpful the presentation has been, how insightful, how educative. So I just want you to know all those lots of thumbs up that are going up for you, and claps and appreciation that's going up. It's important because we know that you volunteer your time and your energy and everything to bring us these wonderful sessions. Now, we've talked about the elderly quite a bit and the fact that they present quite differently, and sometimes it might be just something like confusion or someone acting out of character. Is there any particular reason why they would be confused or act out of character or act differently when they are septic? Is there any reason why? Can you break that down for us?
There is a reason. I mean, as I say, the response is quite different in terms of when there's an insult of a virus or a bacterium or a fungus. It's definitely not the same. You know, as I say, they say that as you grow older, everything goes south. It's as simple as that. So clearly, the immune system is not as robust as it were, and so therefore, if you were looking at the usual rise, because when there's something called an immunoresponse. You know, that response comes in the moment something hits you, your body will respond. Now, because it's not as robust, there's a lag. You see what I mean? There's a lag in the response, and therein lies the danger. And if you don't catch it during this lag period, well, by the time you rise up to it or maybe acknowledge it, or you twig that, oh, hang on, it might be too late. So the importance is the temperature control is not the same. Yeah, it's definitely not as robust, not as alert. You know, the glucose control or, you know, sugar control is not. And you can look at the comorbidities. That's absolutely vital. Yeah, you know, the underlying issues like, you know, hypertension, diabetes, maybe some kind of immune suppression, maybe because of chronic illnesses, malnutrition, you know, frailty, and all of that. And sometimes even the medications they're on, all of that combined together makes them more vulnerable and makes them definitely more at risk than someone who's maybe 20 years younger. I don't know if I'm making any sense.
No, you are. You're absolutely making sense. Thanks for that. Yes, good. And just to remind us, the feedback forms have gone out. So please, if you've got any feedback, we'd like you to complete the feedback form so that we can take your thoughts on board. We are getting very close to the end of the Q&A session. So if you haven't posted your question, please do so now. Or if you want to ask a question and you want to put your hand up so that we can ask you to unmute and ask your question as we engage in this very important discussion on sepsis. And it's important that Dr. Kamara also clarify the difference between sepsis and septicemia at the beginning, because that's something that people tend to confuse a lot. So he's made us aware that the sepsis is where the body is showing this overwhelmed or exaggerated response to the infection. The septicemia is where it's sort of going around the blood. So we are learning a lot, and that's why it's important to come to these health hour sessions where we learn so much and we empower ourselves. Is there anyone who has a question who needs to unmute themselves? Otherwise, we'll give Dr. Kamara the chance to give us his last message, his take-home message for us. And then we'll do the closing. It's been a very comprehensive session, obviously, so you can tell that people have taken in a lot. We've learned so much.
I'm reassured and I'm pleased and humbled that this is a subject that is poorly understood.
It is indeed,
and it's important for us who are more at risk, who are the susceptible groups, i.e. ethnicity and race and creed, that we rise up to this. We actually sort of take up the awareness and try and raise it to the level where we know that we're getting what we deserve, what we need. Because other than that, we would obviously be regretting that the opportunity was there and we didn't take it. And that's the key thing. So I'm pleased that with these small talks, this educative talks, we're actually making some inroads, and that's the importance of it. Because I believe that if I was to say something to you and it actually resonated with you and you benefited from it, you will then be able to pass it on to another person, and the other person will benefit from it. And so it goes on and on and on. And we can never exhaust that, because that's important to actually get that going. Because compliance is a problem, and it's a big barrier in healthcare. There's no questions about that.
Yeah. And we save lives. If someone hears about this and they know how to recognize a patient who's septic, then next time they act quickly and it saves lives. Because sepsis, we know, kills, and it kills fast. So one last question for you, Dr. Kamara. Does it affect our mental health long term? I know you've spoken about this in various forms, but someone would like to know whether having sepsis or being septic or having experienced that would affect one's mental health in the long term.
It's interesting that I can give you the short answer and I can give you the long answer. Now, in the elderly, you know full well that there's anxiety, there's depression, there's post-traumatic stress disorder, there's flashbacks. That is all the impacts. All of those are impacts on the mental health system. There's no question about that. And again, that is directly proportional to the time you spend suffering from the sepsis. If it was a case where you were out, I've seen people in comas, because of the sepsis. So they'll be there for like a month. Clearly, there's something called intensive care unit psychosis. I never knew that until I actually nursed people there. I went for my rotation into ITU. That's when I realized that, wow, all you see is the four walls. You can't speak, you can't talk. You're awake, but there's this tube in front of your neck, which is helping you breathe. And there's nothing you can, this is the kind of thing that would lead to that kind. And then, of course, once you recover, thankfully, you then have these flashbacks. It dips into, you just dip into depression or anxiety or any other of those ailments. And that would cause you problems. So therefore, the family unit, the family cohesion, the family dynamism is absolutely vital in this particular case. In children, that's the other end. Of course, we know meningitis. Believe you me, meningitis can cause after effects like 15, 20 years down the line. Mood swings, not the cognitive, behavior is definitely impaired because of that, depending on the severity. all of that. And sepsis in itself, as I say, is a whole body thing. And so therefore, who's to determine that there are certain things that we've not even touched upon, we've not even discovered yet. So therefore, the best thing for me is obviously to try and prevent it by spotting it. And if you definitely fall foul of it, then definitely try and, treat it as best you can, and definitely prevent those long-term effects, because you would not then be able to sort of respond to them in the way that you'd want to, because there's no telling how it would pan out. But we know then it can lead to epilepsy, and epilepsy would cause problems, with the development of the brain in a child, and of course, the more, mental disabilities and learning disabilities and all of that are all associated with meningitis. And we know that that's the killer. So if it doesn't kill you, it might leave you with mental health problems. And in the elderly, again. So it's there for all to see, and the stats are there, and they're telling you one message: try and prevent it. It's as simple as that.
Thank you. Try and prevent it is the message. And on that note, Dr. Kamara, we just want to say a massive thank you to you for your time. As always, you're a friend of CAHN, of CATHIP, and you're always here when we call on you. And you've given us a very insightful session today. We've learned a lot. Now, for those who might want the slides or the information, please do send an email to health@cahn.org.uk requesting these or any further information, and we will be happy to send these across to you. Thank you to all our viewers who are watching and participating from all the various sites, joining in, making these programs a success, and stimulating and encouraging us to want to come each Saturday to carry on doing this. The more we do this together, the better it is for all of us, the more enlightened we become, and the more empowered our community becomes. Dr. Kamara, 3 last words from you, or 3 take-home messages, or 3 messages that you'd like to give us, and I'll hand over to Lorinti to do the closing for us.
Yes, thank you so much for having me. I hope, as I said, I've managed to convey the message, the seriousness of sepsis. And one thing I want to tell everybody here present, the take-home message for me is that sepsis is indiscriminate. Please remember that. Nobody is above that law of sepsis. Everybody can fall foul. Even inside mommy's belly, you can fall foul of sepsis. Yeah? And of course, at the extreme of life, you can fall foul, more so. So please, one thing I want to urge you to do is be vigilant. And of course, comply to what you've been advised today. And thirdly, with all of us together, we will definitely make some inroads into the prevention, the stoppage, and of course, the complications that would arise. So thank you so much for having me, and I look forward to hearing from you at any time. Thank you.
Thank you so much. And it's been my pleasure. I've been Dr. Diana Asante hosting you for this session. It's been my pleasure. And thanks to all the CATHIP team for the work that you're doing behind the scenes. I'll now hand over to Lorinti to do the closing for us. Thank you.
That's great. Thank you very much. Thank you, Dr. Kamara, for a very informative, fabulous session on a topic not to be taken lightly, also for some great discussions. And thank you to our fantastic host, Dr. Diana Asante. Thanks again. And thank you to all our attendees on Zoom, Facebook and YouTube. So, as mentioned, you can access our Health Hour sessions on the YouTube channel, also previous sessions. Do complete the evaluation link, because we would like your feedback, and some of the upcoming events now I'm just going to go through and share with you. So do pop them in your diary, share them with your family and friends. So to start with, as you can see, today is Jamaican Independence Day, and it's 1 week to the Manchester Carnival, and it's links to the Independence Day celebrations today. So join CAHN in celebrating 50 years of the Manchester Carnival on Saturday, the 13th of August, and Sunday, the 14th of August. That's next weekend. And do remember to pop into our CAHN health tents whilst you're there, enjoying the carnival, and that's 12 till 8 p.m. So in terms of our CATHIP Health Hour for next week, our next session will be on Saturday the 13th of August, 11 till 12:15 p.m. And our topic will be stress and anxiety. And our guest speaker will be Dr. Joseph Omofua. So please make sure that you do attend. It'd be great to have you there. And to register, email events@CAHN.org.uk. And as you know, we have our Healthy Heart sessions as well on Tuesday. So our next session will be by Dr. Evans Asami, our public health nutritional researcher. He will be our guest speaker, and the topic will be the impacts of African and Caribbean social networks on diets and also physical activity, which is really important for us. So that's Tuesday, the 9th of August, and that's 6 p.m. till 7:30 p.m. So please do join us on YouTube or Facebook, or you can email to register for this session on events@CAHN.org.uk. It would be great to have you there. Next slide, please. So do join us at our Black History Month celebrations on the 28th of September. It will take place at the Manchester Cathedral, and there will be food stalls, dancers, singers, and people will be reading some poems as well. And it's all centred around the topic of Black History Month. So please, you don't want to miss out on this one as well. And to register again, email events@CAHN.org.uk. And that's 6:30 till 9 p.m. And on Saturday, the 22nd of October, CAHN celebrates its 5th annual gala anniversary to fundraise for Black History Month. And we invite you and your loved ones to attend this fantastic eventful evening. And there are limited places, so please book your tickets as soon as possible. And you can do this via portal at CAHN.org.uk/gala, stated on this flyer. Also, if you need any support regarding domestic or sexual violence, please do not hesitate to contact CAHN for some support. We have counselling services, which are culturally and religiously appropriate specialist service for Caribbean and African community, delivered by Black professional counsellors. Also, there is a family and advocacy support services as well, which have monthly sessions from 6 till 7 p.m. So if you would like support or to attend any of these sessions, please email help@CAHN.org.uk, or you can just call or text on 077 100 22 382. Please reach out to CAHN. Also, a special thank you to our CATHIP partners. Do contact the services near you if you need any further information. So, you know, from us at CAHN. Next slide, you can contact John. Also, there's the Black Health Improvement engagement team as well. Next slide, the Croydon BME Forum, the Enfield Caribbean Association, and the Royal Assembly Redeemed Church Christian Church of God. Also, RAFA International Development Agency. And that's great. Thank you. So I would just like to say thank you again to everyone for joining us today. So please do contact us if you have any queries, and do enjoy the rest of your day. Take care and see you all next week. Thank you. Bye-bye.
Bye-bye.
Thank you. Bye-bye.
Bye.
Thank you. Bye.
Welcome.
Thank you.
Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@CAHN.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.